For more, let's bring in Dr. Anthony Fauci. He is the chief medical advisor to President Biden and director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, welcome.
Thank you. Good to be with you.
Dr. Fauci, U.S. District Judge Catherine Kimball Mizelle tossed out the mask mandate. As you know, do you personally agree or disagree with her interpretation of public health law?
Well, I clearly disagree. I mean, those types of things should be decided as a public health issue by the public health organizations, in this case, the CDC. This is a public health matter. This is not a judicial matter. The CDC has the obligation to protect the American public, and they make their recommendations based on science and solid public health information. So obviously, the CDC will abide by the order of the court because it's a legal obligation. But one of the problems that we have there is that the principle of a court overruling a public health judgment by a qualified organization like the CDC is disturbing in the precedent that it might send.
And the Biden administration, Dr. Fauci, has previously looked to the Public Health Service Act and the ability of the government to take, quote, sanitation measures as the basis for that mandate. Do you believe masks are a form of sanitation?
Yeah, Bob, I'm going to leave that to the CDC. I will be able to clearly say that I back the CDC's interpretation of this because they are the experts in this area, and they've been doing this for a long time, and they've been doing it very well.
What is, though, Dr. Fauci, the public health cost of what has happened here? Will the judges' lifting of the mandate enable this virus to spread?
Well, what the CDC did was an appropriate, reasonable thing. We were getting to the point of the expiration of the mandate on public transportation, including planes, on April 18th. Since we are in a dynamic situation, because if you look at the kinetics of the viral spread in the country, right now it's on an upswing. It's obvious to everyone. We're seeing that infections are on the rise. Whether or not that will result in an increase in hospitalizations and severe disease, we don't know. We hope not, from what we're seeing in other countries and even the early information from places like New York, where they are, in the sense, seeing that uptick before the rest of the country. It does not appear to be associated with an increase in hospitalizations and severe disease. So the CDC, I think, appropriately said, we need more time, so let's delay it until May 3rd. That was a very appropriate decision based on really the evolving nature of the situation. So right now, masks are important when you're having an increase in the kinetics of the outbreak, as we're seeing right now. So that's one of the reasons why, for those of us who are involved in public health, we back the CDC's decision to extend that in order to look at the data and make a decision based on the data in real time. And that's why it was disturbing to see that in essence being overruled by a court.
Dr. Fauci, you just said we're in a dynamic situation with regard to the virus. You're also the president's chief medical advisor. What has your counsel been to the president in recent days about how to handle this dynamic situation and this ruling on the mask mandate?
Well, Bob, the way we do it, I mean, we have a team and an organization of people who have different backgrounds and different areas of expertise. The CDC has a large number of very experienced epidemiologists who can do the kinds of modeling that might be predictive of what we're going to be facing. It is dynamic, and when something is dynamic, sometimes you don't have all the information immediately when you need it, but you can make projections. So my advice to the president and my advice to the team is let's closely follow the CDC recommendations, because the CDC is best positioned and poised to be able to analyze that information and make the appropriate choices. So this is a CDC decision. And my advice has always been to follow the science and follow the CDC's recommendations.
But so many Americans, Dr. Fauci, when it comes to, quote, following the science, are a bit confused. I ask family members and friends about that, and they say, well, they need guidance, a little clarity. So let me ask you this, Dr. Fauci. If you went on an airplane tonight, if you were taking a flight tonight, and you sat down in your seat, would you wear the mask the entire time? Would you take it off if you're having a snack? Would you not wear it at all? What would Dr. Fauci do?
Well, again, I'll answer the question, Bob, but in some respects, it's an unfair question because we are all individuals and we all have a certain level of risk that differs from person to person on the basis of age, on the basis of potential and real underlying conditions, on the basis of who might be in your home who is vulnerable, so that if you get infected and you bring it back. So when you say, what would one person do? Well, that really applies to that one person and doesn't necessarily can be extrapolated to everybody else.
That's fair, Dr. Fauci, but what about people who feel confused about whether they should wear it or not on the flight?
Well, let me tell you an example for myself. I'm 81 years old. It is what it is. I'm 81 years old. And therefore, given the nature of my immune system, even if I am vaccinated and boosted ×2, which I am at an increased risk if I get infected of having a serious outcome. So if you ask me what I would do, I will wear an N95 mask on a plane for the entire flight. That may not necessarily apply to someone who's 35 years old, otherwise healthy, doesn't have an ill person at home that they need to worry about. And that's what I mean, Bob, when I say it's okay to ask me what I would do, but you really can't extrapolate that to everybody else because we're all different.
What about if someone's, let's say, 25 years old without any pre-existing conditions?
Well, someone like that will have to make their own individual choice of the risk they're about to take. If that person is vaccinated and boosted, the risk is low. It certainly is not zero. And there are going to be plenty of people who are 25 years old and healthy and say, you know, as far as I'm concerned, I don't like the discomfort of a mask. I'd like to have a drink or a snack on the plane, particularly if it's long. So I, as an individual, am willing to take that very small risk. Whereas if someone is immunocompromised and maybe for one reason or other, their immune system is not as robust as it should be, that person has a different acceptance of risk. And that's what we're talking about when we say that in a situation where we ultimately are going to have to live with a virus that's not going to disappear, and hopefully it stays at a very, very low level, that the risk will never be zero. And each of us need to make, and we may need some help of recommendations from our physicians, from the CDC, about some of what the guidelines are. And that's what the CDC tries to do when they talk about the increased risk for people, for example, with underlying conditions.
But does the CDC, with all respect, have any power anymore if one judge can say no thanks to its mandates?
Well, that's what we're worried about, Bob. We're worried about a precedent that would be a dangerous precedent. The CDC has the capability through a large number of trained epidemiologists and scientists to be able to make projections and make recommendations, far more than a judge with no experience in public health.
And you just said this could set a dangerous precedent. Do you believe this sets a dangerous precedent for public health, this ruling?
I do. And that's the reason why the CDC has recommended that the DOJ essentially appeal that.
It's a dangerous precedent in your words. What about a danger to public health? I've heard you say there could be a surge this fall, but are you now looking at a possible surge this spring or summer in the wake of all of this?
We don't know, Bob. To be honest, I mean, I really don't want to make that kind of projection because we have been fooled before by this virus with Delta and with Omicron. And that's the reason why you want to follow these things in real time and see what the patterns are and respond appropriately to the patterns as they evolve.
Do you believe, Dr. Fauci, that this decision on mask mandates is going to have any effect whatsoever on vaccinations in this country? Will it affect how people decide to get vaccinated or not?
I don't know, but I hope, as I always have and say, we really need to do better with vaccinations. We only have 66% of the total population fully vaccinated, and a relatively small percentage, about a third of the population has been boosted. We know unequivocally that vaccines are life-saving. There's no doubt about that. That is solid science. So for whatever reason, I'm always hopeful and continue to encourage people to get vaccinated if you're not vaccinated. And if you're vaccinated and eligible for a boost, to please go get that booster shot, particularly in the era of Omicron. Omicron has already showed us that you really do need 3 shots of an mRNA to be fully protected against Omicron.
Dr. Fauci, you have been a political target for House Republicans in recent days. The House Republican from Ohio, Jim Jordan, said, quote, "Fauci lost, freedom won," regarding the lifting of the mandate. Another House Republican, Madison Cawthorn from North Carolina, has asked his Twitter followers in recent weeks whether you should be put in jail. What's your response to Congressman Jordan and Congressman Cawthorn?
You know, that doesn't even deserve a response, Bob. It's so preposterous. So, I mean, I wouldn't dignify it with a response. It's the most ridiculous thing I've ever heard.
And how would you characterize your relationship with President Biden right now? Is this a job you want to keep for a long time, or will you leave before the end of the year?
Long time is relative, Bob. I'm not sure exactly. I mean, I just take things on a day-by-day basis. I have a very, very good relationship with President Biden. I've had a good relationship with him long before he was president of the United States, and that relationship has continued.
When you step back, Dr. Fauci, and look back at the past 2 years, what's on your mind when you reconsider the steps that were taken early on? A lot of reporters have been thinking about that in recent days, in recent months, marking the 2-year anniversary of when this all started. What's your main reflection about what went wrong in terms of the decisions at the public health level and what went right?
You know, rather, Bob, than it being a what went wrong and what went right, nothing has been done perfectly in this. And I think we all have to be humble enough to realize that when you're dealing with a dynamic, unprecedented situation like this, that there are things that one could have done better. But the thing that really is a burning thing in my mind is the unfortunate nature of how the divisiveness in this country has really hindered what I think would be an optimal response. I mean, when you have an outbreak of this proportion, totally historic, nothing even coming close to this in the last over 100 years, dating back to the pandemic of influenza in 1918, is that you have to approach it in a way where you realize that the common enemy is the virus. And when you have a common enemy in the virus, you've got to all pull together to fight that common enemy. And the degree of profound divisiveness in the country has really hindered that. So we have had a suboptimal response. There are a number of reasons for that. I think the prevailing one is the degree of divisiveness which we have, where we have political issues and political ideologies get tangled into what should be unequivocal, very clear public health principles. That's the thing that sticks out in my mind as the most unfortunate thing that's gone on over these past 2+ years.
Divisiveness is a broad term, Dr. Fauci. When you look back at former President Trump and your work with him, do you see your efforts as successful, or do you have any regrets that perhaps you could have done more to nudge him in a different direction?
Well, I tried my best, Bob. I mean, I did something that was very uncomfortable for me to do. I had to speak up when there were things that were not true that were being said, be they the miracleness of hydroxychloroquine or ivermectin, or the fact that the virus is going to disappear in a few days. I had to speak up and essentially contradict the president. I did not want to do that. I have a great deal of respect for the office of the presidency of the United States. And that was very uncomfortable. I don't know how much more I could have done. I could only say I tried my best to bring an element of truth and evidence and science to it. Several times I was successful. There were things that he did listen to myself and Dr. Birx about, the 15-day shutdown and then extending it to 30 days. But then very soon thereafter, he went out and said, let's liberate different states, liberate Michigan, liberate Virginia, which was contrary to what we were trying to do. So some things were done correctly, but some things were very painfully not correct.
When I was covering those early months, Dr. Fauci, I was wondering myself as a reporter, is Dr. Fauci ever going to step away and say, enough is enough? Did you ever have a moment like that and just decide to stay to try to continue to be a public health leader? Just looking back now, 2 years on, were there any crisis moments we're not aware of in your own experience?
No, Bob, to be honest with you, not. I mean, there have been some tough times, particularly as you mentioned, when I had to get out and speak out against some members of the administration as well as the president. I did not like that. I do not like having to do that. I am very respectful of the presidency. But I never said to myself, I want to walk away from it. I've always said, we've got to get this thing under control. I'm obviously 81 years old at the point in my career where I'm going to have to step down at some time. But I would want it to be when we get this under better control. And we may be coming to that point right now. We may be closer to that now than we realize. And I will take things on a day-by-day, week-by-week basis and decide, what it is that's most important for the country. I mean, my job for the last 50 years in government, actually 54 years, but 38 years as the director of this institute, has met the challenge of a number of outbreaks, from the really extraordinary, painful years of HIV/AIDS in the beginning, to Ebola, to Zika, to pandemic flu, to all the things, and now COVID. So my job is to focus on what we do and what we do very well. I mean, and I think an example of that is how we were able to get vaccines out to people so quickly in unprecedented time of less than a year, which has saved millions of lives. That's what I focus on. So when all of the difficult things occur, just focus like a laser on what your job is, and all of the other stuff is noise, be it the criticism that you mentioned from people who are talking nonsense about my taking their liberties away. I'm not taking anybody's liberty away. I'm just trying to save the country from suffering and disease, which is what I do as a physician, a scientist, and a public health official.
Dr. Anthony Fauci, really appreciate your reflections on both present and past. Appreciate your time. Thank you.
Thank you. It's good to be with you.